Hey TJ, it's Quinto. Thanks for the video response to my latest posting. I do in fact remember you, and I think it was we did communicate at some point. It wasn't just you posting comments on my videos. I think we did have an exchange. Um, I can't remember how detailed it was, but that's not saying much because I don't remember a lot of stuff these days. Anyway, I think you brought up a really good point in your video response, and my response to your response is that I think there's a big difference between people asking what happened to me and me telling people what happened. Um, and I do understand that people don't ask me what happened to upset me. It's because they're curious, or maybe they have some sort of disability themselves, and they're looking for some sort of kinship, some sort of a bonding, a common denominator, or as I the other option, they're just curious. Often when people see someone my age in a wheelchair, they wonder what could possibly have happened to me, and people often assume that I had sorry that I had a terrible accident, that I was in a car crash, for example, or that I was in some sort of sports related incident. So people are often curious about that because it's such a a violent incident, and it draws a lot of attention. That's at least my take on it. The reason that I get upset is one of the reasons that is one that you brought up, that I do get asked all the time, and the one of the other reasons is that this question can come at me anytime, anywhere except for in my own home. So anytime I go out into public, I am at risk, so to speak, of being asked this question, and often I'm caught off guard with the question. For example, I'm sitting in a food court having lunch, and someone comes up to me and says, "Hey, what happened to you?" And I look down at whatever I'm eating, and then I look up at them, and then I look back down at my food, and then I kind of look at myself, and my mind isn't in the right space to answer the question because my mind is on my lunch. Or, I leave a very, very intense therapy session, and I'm out on the street wheeling up the sidewalk, and I stop for a moment to strap my foot back in because it falls out, and someone comes up to me and says, "What happened to you?" Or I'm on the subway, and I get into the elevator, and there is a person who is ambulatory who walks into the elevator, and the door closes, and they're standing next to me in the elevator, and they kind of look down at me, and they pause for a second, and then they say, "So what happened to you?" And here I'm riding this elevator, and all of a sudden, I'm expected to launch into this discussion about what happened to me. It's difficult to answer that question when you're not prepared to do so. And I also get upset because I feel like, and I don't know if this is true, but this is something that I've gone over with several scholars that live in my area. Anyway, this idea that people feel that they have the right to knowledge of disabled bodies. Sorry, I'm using the word disabled in quotes here because I don't identify with that term. I I use other terms, which I'll go over that in another video, I think. Otherwise, this is going to take forever. But this idea that people have just have a right to knowledge of disabled bodies, people in this sense being able-bodied people, they feel that they have a right to knowledge of disabled bodies. And one goal of the question, "What happened to you?" is prevention of disability, because disability is not desirable in our culture. So people on some level, when they ask that question, are trying to figure out what happened so that they won't get into that situation themselves. So for example, if I'm in a wheelchair because I was um, drinking a Starbucks coffee whilst snowboarding down the side of Mount Everest, and then my iPhone rang, because clearly I have phone service on the side of Mount Everest. Anyway, then my iPhone rings. So I spill my coffee while trying to answer my iPhone, and I swerve off the path and crash and sever my spinal cord at the L1 level, which would make me paraplegic. Say that happened. And then, a year later, I'm somewhat recovered, I'm in my wheelchair, and I get on the subway, and I'm in the elevator, and someone looks down at me and says, "What happened to you?" And I go, "Well, I was snowboarding down the side of Mount Everest, drinking a Starbucks coffee, and then my phone rang, and I thought it must be my agent. So I answered the phone, but I spilled my coffee on myself, and then I swerved off course, and I hit something. Can't remember what. And I crashed. And I severed my spinal cord at the L1 level." Then that person would look down at me after listening to the story and go, "Oh, I'm so sorry." And in their head, they're thinking, "Well, I'm never going to snowboard down the side of Mount Everest drinking a Starbucks coffee and answering my iPhone." They may not be thinking that on a conscious level, but often people are thinking about how they can prevent disability by interrogating disability. So, sorry, that was a little bit dense and maybe a little bit too abstract, but this is the kind of stuff that I'm getting into lately. And I personally don't feel that people have the right to knowledge of what happened to me just so that they can prevent it in themselves. I don't really agree with that use of myself, I suppose. And I don't feel that I have to answer that question all the time. Mind you, often if I am caught off guard and someone asks the question, I will answer because I can't come up with anything else to say. But, and this is the next point, often people who use chairs or another mobility device, or who have some sort of visible disability that is acquired or not, just any disability that is visible, and someone asks them what happened, often it's very personal, and it can be upsetting not only to be asked that question, but to have to answer it. Some people have post-traumatic stress disorder that is related to their disability. And being asked that question and having to answer it, I mean, it could trigger all sorts of really terrible emotions. And for me, it's not that extreme. It doesn't launch me into some sort of downward spiral, but it is upsetting for me to have to think enough about it to answer that question, or to go over it again and again and again. It hasn't gotten better over time yet, answering that question. Eventually it may, but it may not, or it may take a really long time, and that's okay. But it's not a question that I feel I have to answer now. However, on the flip side, on the other hand, there is telling people before they ask, or if they don't ask. If I feel that it's relevant to the conversation, or if maybe I just want to talk about it that day, or maybe I feel that that person is really great to talk to, or something, then I have the option of bringing it up and talking about it. And doing so before someone asks, or when someone does not ask, or when the question is hanging in the air but it is not asked. I hold the power, so to speak. It's not the right word for it, but I'm the one that's controlling the situation. So I have the option of telling the person or not. I have not been asked, so there is no pressure on me to answer a question that has not been asked. And I can take it in any direction I want. That's the kind of situation that I prefer. Because I'm able to tell people as much or as little as I want, and I'm able to tell people on my own terms. And I think that's really important. I've obviously lost control of a large part of my life and my body, being, my legs. And conversation or dialogue is one thing that I can have control over. And telling people is something that I feel I should be able to direct. And I think that's okay. I don't think there's anything wrong with me wanting to kind of keep a handle on who I tell and how I tell them. And not wanting to be asked that on the street or in a waiting room or on the subway or, in the lobby of my apartment. The list goes on. Restaurants, parks, bathrooms. I mean, just think about that one. If you're in the bathroom and you come out of the stall and someone goes, "What happened to you?" And it's like, whoa, I just finished in the washroom and I'm trying to wash my hands. And it does get very overwhelming. So, again, I don't think there's anything wrong with not wanting to tell people. But I understand that some people get frustrated when I don't tell them. And I don't mean to frustrate people, but I do need that safety for myself. And safety is a large concern for me these days, and I need to know that I haven't disclosed any information that could potentially create an unsafe situation with that person. And that's very, very possible these days. Last point, I don't like people playing doctor with me. And some people, not all, and not most, just some people, feel that, they ask you what your disability is, and you tell them, and then they play doctor a bit, and they ask, have you tried this? Have you tried that? Have you seen this doctor? Have you eaten an entire raw tuna fish, scales and all, 5-foot long tuna fish? Have you done it? It'll make you better. And all of a sudden, I'm being bombarded with all of this medical advice from people who are usually not doctors or nurses or anyone who is fit to give that kind of advice. And it again goes with this line of thinking that people feel that they have control. I fucked up. This idea that people feel that they have the right to know about my body and my disability, and that they know all about it already. They just need to know which one I have, right? And I mean, the person that knows one's own body the best is oneself. And most people are not willing to accept the fact that I have tried almost everything, except for eating the whole 5-foot long tuna fish scales and all. I haven't tried that yet. I'm vegetarian, so I don't think it will work out. But you know what I mean? It's all of the comments that come after my explanation. That's what upsets me. And eventually I will talk about it on YouTube. I just need a bit of time. It's not super easy to talk about, and although I put on, you know, the Quinto face where I just look neutral or happy or sardonic, there are feelings inside somewhere, and sometimes it really hurts. Anyway, thank you so much for your video response, and I know this is like 16 minutes long, and I apologize for being a little bit long-winded, to say the least. But thank you again, and I'll see you guys later.